Hi, my name is Stephanie Piccolo, and I want to thank you for taking the time to consider me for a position in the Pediatric Capstone program. I knew from a young age that I wanted to work with children and have spent my entire life dedicated to working with the pediatric population. Like many, I began in babysitting and nannying when I was in high school. I received my degree in biomedical sciences from Texas A&M University and went on to become a life science high school teacher. I ran a grant-funded program in the areas of math and science designed for students with intellectual, physical, and mental disabilities. I later went on to become a newborn care specialist and parent educator, providing care for pediatric clients in their home environment. I educated parents on child development and provided varied parenting methods to encourage growth while establishing behavioral modification to assess progress towards goals. I craved more acute care of the pediatric population and decided to transition to nursing to one day be a pediatric intensive care unit nurse. One of the things I love about pediatric nursing is that it involves care for a wide range of ages and developmental stages. Most importantly, a pediatric nurse doesn't only provide care for the child, but also the family as a unit. I was fortunate enough to be offered a position as a professional student nurse in the PICU at Texas Children's Hospital. This experience has solidified my passion for pediatric nursing and has helped build the confidence and skills I will one day need as a nurse. During my time in Care 1 and Care 2 clinicals, I learned the importance of time management, patient prioritization, proper assessment, and foundational nursing skills. I was also able to implement my knowledge of pathophysiology and pharmacology. I specifically recall one instance where all of these skills and knowledge came together in clinical. After assessing a patient, I determined that her respirations and level of consciousness had decreased from a previous assessment. Analyzing her chart, I was able to determine that her dosage of Dilaudid was too high given her liver and kidney status, and that she was likely experiencing an overdose. I immediately called a rapid response and was able to administer Narcan. In my community clinical, I chose to be placed at the UT Physician High Risk Pediatric Clinic. I had the opportunity to work with children experiencing diverse congenital conditions such as CDH and heart defects, as well as long-term health consequences experienced from premature birth, such as BPD and ventilator dependence. We had an RT on site, and I had the opportunity to gain in-depth knowledge of mechanical ventilation. Additionally, I had many opportunities to provide parent education on oxygen supplementation, medication administration, and vaccine necessity. During my time in clinicals and as a PSN at TCH, I realized that a major issue faced by nurses is the red tape from insurance, manufacturers, and hospital administration. Working at UTP High Risk, we frequently face the issue of growth hormones being unavailable by manufacturers or health insurance companies denying approval for the only available formulas. This required countless hours of legwork as a nurse to advocate for the patients so that they could receive the medication they needed. At TCH, I realized that at times, products needed are just not available or in stock due to backorder. This past week, I had a patient that needed a specific colostomy pouch. When hers leaked, we were unable to replace it due to a manufacturer backorder. Towels had to be placed on her abdomen until the surgical team could come to find a solution. This child was severely immunocompromised, and because of a product shortage, we could not provide the best care to minimize her risk of infection. Additionally, there's a large population of non-English speaking patients and parents at TCH. There's typically only one Stratus machine available, and interpreters are frequently backed up with patients. I one time had a bacterial meningitis patient experience a tonic-clonic seizure. The mother was Spanish speaking only and terrified and confused. A Stratus was unable to be immediately provided, and an interpreter did not arrive for over an hour. We were unable to provide her the best care and explanation of events simply because of a lack of resources available. To address these issues, I must persistently advocate for my patients and their families' needs. It's important to get involved with management and leadership so they're aware of the issues faced at the nursing floor level. It's incredibly important to advocate at the organizational level as well. I plan to join nursing organizations at my hospital and in my state so that I can be a voice for patients and nursing needs. I believe that my academic and pediatric experience make me an ideal candidate for the Pediatric Capstone program. Firstly, I am a high-achieving student who puts 100% effort into everything that I do. I spend time outside of school and clinicals researching things such as advanced ventilator and drip management. I'm a tutor for pharmacotherapeutics and pathophysiology courses at CISIC and have an in-depth understanding of both, including how they apply to the pediatric population. My experience at Texas Children's includes caring for patients with acute needs in the surgical, trauma, hem-onc, pulmonology, neurology, general medicine, and transitional PICU floors. I have experience with advanced nursing skills such as management of endotracheal tubes, mechanical ventilation and oxygen supplementation, tracheostomies, chest tube care, arterial and central lines, EEG and intracranial pressure monitoring, syringe pump operation, and drip medication titration. I thrive in high-intensity acute care situations with the ability to remain calm and support the family unit. I recall a time when a 3-year-old on mechanical ventilation for respiratory failure desatted to the 50s. His pump was not administering proper boluses of pain medication and sedation. Parents were crying and the room was frantic. In that moment, I stayed calm, suctioned his ET tube, adjusted his FiO2, and helped to reprogram the pumps, all while keeping the family up to date on what was happening. Additionally, I have experience with staff assist and code responses, including CPR and emergency intubation. I effectively communicate with interdisciplinary teams, including physicians, nurse practitioners, respiratory therapists, interpreters, and child life specialists. To conclude, I believe I am the perfect candidate for a pediatric capstone placement in a high acuity setting such as the CICU. I want to thank you again for your consideration and can't wait to join you in the world of pediatric nursing.